The PRP. For knee arthritis, I wouldn't do it. I wouldn't do it on myself. I wouldn't recommend a family member to do it.
Welcome to episode 14 of the Physio Diaries podcast. We have a very special guest joining us today, Dr. Diego Barragan. Did I pronounce that right?
You did. You did a very good job.
Okay, good. Who is an orthopedic surgery resident. So, Dr. Barragan, would you like to start off by introducing yourself a little bit to our audience?
First of all, you can call me Diego.
Okay.
I always tell people they can call me Diego because my last name can be a little hard to pronounce. A little bit about myself. I'm originally from Bolivia. Moved to the U.S. when I was about 15. Did most of my schooling in Portland, Oregon. Did undergrad there, and then I moved to Chicago for medical school. And I stayed here for residency, and now I'm doing residency in orthopedic surgery, and I'm interested in hand surgery and currently applying for fellowship for hand surgery.
Oh, that's exciting. That's awesome. Were there any specific experiences in your life that kind of drew you towards medicine, or more specifically orthopedic surgery?
I think so, for sure. My dad is a doctor in Bolivia. He's an endocrinologist. At first, I really did not want to be a doctor because he was working a lot and he wasn't home. And I figured, I don't want that kind of life. But then after I moved here, I was very interested in all the sciences, mostly biology. So I said, you know what, I'm maybe going to try to get a PhD in biology. And I tried to do research for a while, and it was lab work, working with mice on cancer immunology research. And there's just like an aspect missing. I feel like I'm a very extroverted person, and I was missing kind of that human connection. I was curious. I was like, you know what, maybe I'll try it out. And I went to Bolivia and shouted out some doctors, went to the operating room, got to see a bunch of orthopedic surgeries, and that kind of sparked my interest. And that's when I decided, you know what, I think I know my dad's busy, but he's very happy. I want to do something similar that makes me happy and is rewarding. To me, medicine is like a mix of all the sciences and disciplines, and all of that is applied, and that was really attractive to me. Once I was in medical school, I figured I'm going to do endocrinology just like my dad. And I did the internal medicine rotation, and I just didn't like it. I felt like a glorified clerk. I wanted to do stuff with my hands, and I felt orthopedics was a very, has very creative solutions to problems, and I think that's why I was drawn to it, because it resonated a lot with my personality in that aspect of me, I guess.
Cool. Yeah. What brought your family over to the States from Bolivia?
Well, my parents, they've been divorced for a really long time. My mom, she has a sister who lives in Portland, Oregon. She's a professor at UP. And she went to visit her, and she met someone, and they dated for a while, and then they got engaged, and she got married. And she told me, we're going to move to the U.S. if you want to come with. I think it was 14 or 15 at the time. It was, when she told me that. And I figured, you know what, it's probably better if I go there, because, probably better opportunities for college and whatnot. And so we moved, and it was a complete change. Yeah. But it was good. I mean, being immersed in different cultures really opens your eyes, and I think it was a great growing experience. And obviously, being where I'm at now, I'm very happy with the decision that I made, and I'm very grateful for my mom to taking that leap and deciding to move over here. I know it was challenging and it was tough for her.
Yeah. My family has a similar background. Like, I don't know if you know, but our family's from Ukraine originally, and they moved in like 92. And so I always used to think as a kid, like, what if they didn't move? Like, what would I have been like if I was still in Ukraine? Like, now I'm kind of like, thank goodness that they moved to the States.
Exactly.
Because I know it wouldn't have been good right now.
No, I know it would be
But
tough.
You said you went to school in Oregon. Was that undergrad or medical school?
It was undergrad. So I finished high school in Oregon, and I stayed there. I went to Portland State University. Gotcha. I actually had a great experience there. I really liked it. I remember I really wanted to go to OHSU for medical school. and it didn't pan out. And then I came to UIC, and I really liked it, and it just all worked out. It's something that needed to happen.
Okay, so you went to UIC for medical school and then residency
Yes,
too.
correct. I did both of
Okay.
them. Yeah.
So you've been in Chicago for a couple years now.
It's been about 8 years now that I've been in Chicago. Yeah.
So you feel like a local by now.
I feel like
Yeah.
I am, because this is the city in the United States where I have lived the longest.
Yeah.
Yeah.
Yeah. I love it. I'm a travel PT. And so I was living in Chicago for 4 years in PT school.
Mm-hmm.
And now I've been to Washington State and I loved
Nice.
it. Didn't get to go to Oregon, but I really want to go to Oregon at some point. And yeah, it's just fun to explore, but I still love Chicago and miss it every time I go back. We have a lot of student listeners. So for those that are interested in becoming a surgeon or specifically an orthopedic surgeon, this is for you. Could you tell us a little bit about the schooling that you had to complete? I know you kind of touched on it a little bit to become an orthopedic surgeon.
Of course. Obviously, you have to go to college, and you have to finish your degree. It doesn't have to be in any health science related field, but you have to do the pre-med requirements. It's very helpful to do research and volunteer work during that time to have a very solid application. You have to take the MCAT, and it's actually weighed very heavily. So I would recommend that if you're in that path, you take a good chunk of time to study for it, at least 6 months.
Oh, wow.
In order to apply and be competitive. Then you have to complete medical school. Orthopedics is one of the more competitive specialties.
How long is the orthopedic residency?
5 years.
Okay.
5 years, and then there's different subspecialties, and each of them is 1 year.
Gotcha. Okay.
Most people end up doing a fellowship. I think 6 years is more of a, more accurate number.
Okay. Yeah, that's a long process,
It
but
is.
you're like towards the very end of it, basically.
Yeah, I have 1.5 years left of residency and 1 year of fellowship.
Okay. Nice. Yeah. Do you know, or you said you're applying to fellowship programs right now?
Yes.
Are you applying to do you usually apply to a couple different ones?
I think I applied to 44 different programs.
44?
Yeah.
So those 44 applications you had to do?
Well, it's just one general application, and you
Okay.
just send it out. Yeah.
Gotcha. But then
and-
you have to pay for each one too, right?
Yes, pretty much. I think you have
Wow.
like 10 free ones, and then the other ones are 20, and after a number, it goes up.
Okay.
Yeah, because they
Gotcha.
want to limit how many places you apply to.
Yeah.
But thankfully, the match for fellowship is much better than for residency,
Right.
and I think the match rate is close to 100 for hand surgery. So it's a
Awesome.
much
Yeah. Because you already
calmer
made
process.
it through the residency part, so
Yeah.
they know that
Yeah.
you can do the last hand specialty.
Hopefully.
Hopefully. I don't know if you touched on this, but what made you specifically decide hand and upper extremity as your specialty?
Well, after I finished medical school, my path to orthopedics was not the conventional one. I didn't match the first time around. And looking back, deficiencies, one of the big deficiencies I had was research. And so I did a research year. And in that research year, I was doing or working with a team and doing some projects in nerve regeneration studies. And the projects involved doing microsurgeries on rats, and we're doing experiments on sciatic nerves, and the sciatic nerves in rats are about the size of a digital nerve in a hand. And I just really found microsurgery and doing all that small work really calming. Like, I was able to hone in and focus on the procedure, and I that sparked my interest for hand surgery. And then once in residency, we've got great mentors for hand, great attendings that get you involved in the operating room early on, and they're terrific. And I think that kind of drew me to the field even further.
Cool. Yeah. That's funny because you said you were working with mice and doing a little bit of research beforehand too.
Yeah.
And then
yeah.
you did that a little bit
Exactly.
later on too.
Yeah.
Yeah. So it's sciatic nerve regeneration, right?
Yeah.
Okay. So peripheral.
Yeah, peripheral nerve.
Okay. Well, that's really cool. And you reapplied and
then I reapplied, and thankfully I got in, and
Yeah.
And now we're here.
awesome. Yeah. What are your thoughts on how medicine is being taught in our country? And what is one thing maybe you would change, and one thing that you really like that
Well,
they do?
I think in other countries, most people go into medicine right off the bat. I think I actually kind of like the fact that it's a graduate program. It ends up taking about the same amount of years, maybe one more. But it's a field that consumes so much of your life that
Yeah.
if you're not absolutely 100% sure that's what you want to do, you shouldn't pursue it because it's going to take so much of your life.
Right.
And I think having that pre-med period and having the applications be hard and difficult in a very involved process stops a lot of people who would not be happy from entering the field. Because if you don't want to put in the work to do that to begin with, I think it's sparing a lot of people a lot of heartbreak.
Yeah.
So I think that's actually a good thing. I do think that the way that things are being taught could be better. We live in a time and age where sometimes the best teachers have resources available online. And so you end up teaching a lot of that stuff yourself. And that happened to me in medical school for some subjects. We in classes, we had great people teaching us and they were amazing, but for others it wasn't even worth to go to class, and you just use the online resources and learn things better that way. And so getting those resources more incorporated into a curriculum, I think, would be something that would be very helpful.
I definitely agree. Like, I know at least in PT school too, well, I was also going to school during COVID, which was kind of tough, but a lot of the things that I would have trouble with, I would just look on YouTube and have somebody explain it in like 2 minutes, and I'd be like, okay, why did they make it 10 times harder than it needed to be? But yeah, there's so many resources out there, and I wish that it was all kind of more in one place for us somehow. We did have an episode kind of talking about burnout and kind of like work-life balance, especially being in the medical field and working a lot with people that are in pain and kind of suffering basically. And so obviously orthopedic residency is known to be one of like the hardest residencies out there. It's very physically demanding and can be stressful with long hours. So how do you kind of find somewhat of a work-life balance in your life between all the surgery and clinic hours?
I think, burnout is real for sure. I feel like I've experienced it at some point, and you notice in the quality of work that you do, and the joy that it brings you goes down just because you're doing so much of it, and it's real. I think we're very lucky at our program. I think we have a very good work-life balance. We have enough time to do regular life. And I think that's the saving grace. We just have a program that encourages it and supports that. And even though, taking call gets harder each year just because you burn out a little more, or you're
getting older.
You're getting older. You're that call bed is getting a little more uncomfortable every night. But I think we have a very good program that allows you to kind of pursue your hobbies, do things outside. I think for me, a very big support is my wife. Shout out to her for being there for me whenever times are rough, and in a way forcing me to take time for myself and for us to do activities, and encouraging me to pursue things that make me happy. So I think having a good support system and making specific time for things that you like. For me, I enjoy running. I enjoy working out, and I it helps a lot with the stress. And so finding time and carving out a specific part of the day to do that is, I think, very important.
Yeah, I agree. It's important to do things that like are totally out of like your career. Like even in like PT school too, we would just go out and like do activities like nothing related to PT, just like leave the books at home, hang out with our friends, and just have hobbies, you know, do something outside of school. And that's something that we like touched on in our podcast about that too. I was going to ask you, what does like a typical week in your life look like? Like how many days are you on call? And when you are on call, how long is that period of time?
Well, that's something that has varied a lot over the years, and it depends a lot on what rotation I'm on. If I'm on a trauma rotation, depending on what site, I could be waking up at 4:45 in the morning, signing out at 5:45, rounding, going to the operating room, being there till like 6 p.m. And then, as a PGY4, thankfully, don't have to take much call at one of those sites, and maybe I think it's like 2 over the course of 8 weeks, which is not really much. But on the weekends, we call it wild card. So if there's cases, you go around, and if there's cases, you stay and help for that. And so you have to do 3 of those, and so sometimes you're working for 14 days straight. Sometimes you're lucky and you have a weekend off. But overall, it averages out there's recommendations and guidelines for how many hours you should work, given by the ACGME, and it's I believe 80 hours per week on average, averaged out over 4 weeks, and I think 1 day a week off on average. And if you're on call for 24 hours, a post-call day, and I think in the program we stay within the limits, which is good.
That's good.
Yeah.
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 How do you stay awake? Like, do you just drink a bunch of coffee, or
You're
just running on fumes?
Sometimes you're running on fumes.
Yeah.
But your body gets used to it.
That's true. Yeah. Because
It's-
if it was like, if you were just working 40 hours a week and then went to like, residency schedule, you'd be like, whoa, but you've kind of been, it's almost like you've been
Exactly.
running a marathon like this whole entire time, and you're trained, like you're used to it.
Yeah,
So,
it's funny how fast my body can adapt to a different schedule now.
Yeah.
We went on vacation to Dubai in June, and there's I don't even remember how many hours, but there's a huge time difference, and it didn't even take me a day. I was able to just flip and didn't feel tired, was fine. But I think it's because when maybe you don't have call for a week, but then you're on call, you have to be awake for 24 hours or
Right.
get woken up, and your body just gets used to it.
yeah, that's a perk. That's definitely a plus.
Exactly.
Yeah.
It helps for international travel.
Yeah. When you have time for it.
Exactly, when you have time for
Yeah.
it. But we do have vacation time, so
Do you,
it's
how
good.
many weeks, I guess, in a year do you guys
You
usually get?
have 4 weeks in a
Okay.
year. You can take one. You can't take more than 1 week in a block. And then 2 people can't take the same week. But we have a schedule. We find the time. And if you for some reason take less 1 year, you can have it roll over for the next
That's
year.
nice.
So
Yeah.
it's kind of nice.
Yeah. Yeah. That's actually more than I thought you guys got. So that's good to hear.
We get a good amount.
Yeah. Awesome. You said that you run outside of residency. That was one of your hobbies.
Yes.
Is there anything else that you like to do?
Yes, I have a bunch of hobbies actually.
Okay.
The main ones are probably running, making videos online. I think that the content creation has become one of my biggest hobbies. I also enjoy swimming. I used to be a swimmer.
Oh, me too.
Oh, nice.
I sucked.
I wasn't the best either, but I
Yeah.
enjoyed it.
It's fun.
Yeah, exactly,
I did
exactly.
it for the pasta parties.
There you go. I enjoy cooking and playing guitar.
Awesome. All good things. Yeah. Yeah, I was gonna say I swam in high school, but it was a no-cut sport. And I was like, my friends were like, you should just join. And I was like, okay, sure. Like, how many practices are there? They're like, a couple times a week, but they're optional. And I was like, okay, sure, count me in. And I remember I was drowning like the very first day. I was in lane 6, like at the end, holding on to the side of the pool. And I was like, it was so bad. But my first time trial was like for a 50 free there and back was 1.5 minutes, which is like extremely slow for people that don't really know swimming. But then after 2 seasons, I dropped like a whole minute and I was in like
That's
the 30s.
great. That's actually pretty good.
It was the best shape I've ever been in my life.
That's
but
great.
it was also the hardest sport I've ever done. So when I go swimming now, I'm just like, okay, just for fun, a little like breaststroke, doggy paddle. But yeah, it was fun.
I don't feel swimming gets the credit it deserves in terms of how hard it is. I remember during those practices just feeling like my entire body is hurting and I have to keep going because the coach is, just
Yelling
on the
at you
sideline,
and you
yelling
can
at
hear
you.
him from the water.
I know. So I was so tired.
Yeah.
All the time.
Was that in high school?
That was in high school.
Yeah. No, if you need to get in shape, like just start swimming. What was the most unusual case that you've encountered in your career so far?
So we work with this attending. He's an onc and complex joints attending. And a lot of people who just don't know what else to do, they send patients to him. And we see some crazy stuff. The one thing that comes to mind, it was this case where the patient had a prosthetic joint infection. They had a knee replacement. They got infected and they had several washouts and they ended up getting a static antibiotic spacer, which basically means her leg was straight and in between the tibia bone and the femur bone, there was a piece of metal with rods going into each of the bones and bone cement mixed with antibiotic so that bone cement can have higher concentration of the antibiotic that your body can take. And the idea is that that's going to help kill the infection. Now,
Wait, her knee, could she bend her knee?
not anymore.
Oh
And
my
so
goodness.
the infection didn't completely disappear. And because of that, the implant loosened and the bone was frail, and the rod that was in the tibia went through the tibia and was hitting the talus. So it went into the ankle
All the
joint.
way down.
All the way down to the ankle
leg.
joint. And so we had to revise that. And obviously this was such big surgery. She had so many. She had flaps with plastic surgery. They had to come in, open her up. We had to take a huge chunk of bone. And to rebuild that bone, we used this thing called a compress. And the compress is this device that positions to the bone cortex that you just, you cut the bone and then you put it on top, and it has this little rod that goes in the medullary canal, and then you put some pins, and then you load it, and it puts a lot of pressure between the bone and the interface of this implant, just to motivate the bone to grow into the implant. Wow. And then this implant is modular, so you build pieces on top of it to get to the length that you want, kind of like Lego pieces. And then we attach that back to the piece that was attached to the femur.
Wow.
And then we coated everything with antibiotic cement again. And then thankfully plastic surgery came in,
made everything
down
look nice.
the flap and stuff. And that was, it was a crazy case.
That sounds wild.
Yeah.
I mean, we see a lot of knee replacements, and I've seen some infections after it, but nothing like that. Yeah, that's pretty wild.
Yeah. So that was one of the wildest cases. And I think it's one of those cases that maybe people in fellowship won't ever even get to see.
Yeah, that's like once in a lifetime.
Exactly.
Probably, or if ever.
Yeah. But when you're with Dr. Fareed, it's like once every month. It's crazy.
Wow. Oh my, he must be a really good doctor.
He's amazing. He's amazing.
How long ago was that?
That was about a year ago.
Okay.
Yeah.
Do you know how she was doing after all of that, or like how her function was?
The latest I knew is that the incision had healed. Okay. Which is a good thing.
That's good, yeah.
But I haven't had a chance, just because we rotate out of place and then we stop.
You can't really follow up.
Exactly. But I'm sure that when I go back to UIC, they're still going to be following up with him. So I'll get a chance to figure out how she's doing. Hopefully well.
Yeah, wow. That is quite a crazy story. Yeah, we see a lot of different patients, but there's some, for me at least, that almost never leave you. And I feel like that would be one for me. That when I would just wake up and be like, I wonder how this person's doing. Yeah. Like that'll just happen to me. It'll just hit me. Like something will spark a memory of that patient. I'll be like, I wonder how they're doing. I hope they're doing okay. Yeah. We recently, actually this relates to your knee replacement, sort of like arthritis. But we had an episode that was discussing the different treatment options for osteoarthritis, which include like hyaluronic acid, there's PRP, and cortisone, which is a more common one that's used. What are your thoughts on these different types of injections, and what have you seen in the clinic?
Okay, let me start by saying that what I'm going to give is my opinion, and it's not a medical recommendation for people. This is my opinion based on my experience and obviously some evidence-based stuff. I think with arthritis, obviously you should always start with conservative management, physical therapy, over-the-counter anti-inflammatories, and then after that, step up. Cortisone injections are effective. I think they work, and there are certain patients, because of health reasons, that may be the best answer. I think that the hyaluronic acid or the gel injections, it's a 50-50 type of thing. There's people who swear by it, and then other patients who just don't have any benefit. A lot of times insurance won't cover it. And
that's what I was going to say.
I would say if insurance doesn't cover it, it's not worth trying, because it's a coin toss, right? And you're spending $1,000 on a coin toss. I think that a lot of people, for a lot of people, if you have the money and you want to invest it in yourself, that's completely reasonable. I understand. I think it's worth it. But it's the evidence is mixed.
Yeah, we were looking into it too. And I think that, just based off of my personal experience with patients that have gotten it, it really does seem like it's 50. And sometimes they even have to get like multiple injections to even experience some relief.
Yeah.
Like usually with like the first one, you don't really experience a ton of relief.
Exactly.
And yeah, it's not always covered by insurance. So that's why it's tough, because there's a lot of patients that can't afford those injections for it to potentially not even work.
Yeah,
So
I agree. And then the PRP for knee arthritis, I wouldn't do it. I wouldn't do it on myself. I wouldn't recommend a family member to do it. Again, the evidence is very mixed, and there's some evidence that shows it's good, other that shows it's bad. I think there isn't a correct formulation with, there's different protocols for how to mix it and how long to spin the blood and all these things, and there's just so many factors. I don't think you can get a consistent result each time, and that is always, I think, excluded, never covered by insurance, and it's not going to fix the problem. That's the thing. Arthritis is going to progress, and if you have it, eventually you're going to reach the point where you need a knee replacement. And I think it's one of those shared decision making moments when you're talking to the patient. You've already tried the conservative management, and you tell them you can prolong the problem and, put a Band-Aid on it with cortisone injections, which may actually progress the arthritis over time, or you can get a knee replacement now. Again, it varies on the patient, and everyone, they know themselves best. We're going to see you for a couple of visits, and it's 30 minutes total, and I'm supposed to know how your life is and how active you are and what your lifestyle is. It's not realistic.
Yeah.
But the patient knows, and I think that it is important to have that conversation and be able to offer them if they want. I personally, again, this is my opinion, think that if you're relatively young and you've got arthritis and it's going to progress.
What is relatively young?
I would say for knee replacements, I want to say 60.
Okay.
I think for knee replacements, they're relatively young. I think for knee replacements, 50 is pretty young. Some people have arthritis at that age already.
Yeah.
And I think at those ages, maybe you want to kind of prolong it a little bit before they get the replacement, just because of the lifespan of the joint. But if you're about 65, say, the lifespan of the joint it could last you like 20 years very easily. And I think it's very reasonable to do it, because if you keep waiting, the arthritis is not going to get better. Your soft tissues are going to get laxer. The surgery itself might be bigger or more difficult. And I think that's going to affect your outcomes. You can do a knee replacement on a knee with, with arthritis, and then you can do a knee with a lot of arthritis, and you have to put augments, you have to put stems, you have to do a lot more things. You're under anesthesia for longer. So thinking that waiting is always benign, I think is very case dependent and can be naive sometimes. Yeah. But again, this is my opinion, and there's a lot of research in knee and hip replacement stuff. And
I have a quick question.
Yes.
So I did have a patient who was in his 50s that had bilateral knee replacements. And so once you get to that 20-year mark, where the joint, what happens to the joint, I guess? Does it just start to wear down and then they need a new joint replacement after?
So it depends. It's at 20 years, you've got a good survival. It might be good for longer, especially now they've got better polyethylene that doesn't wear down as quickly. And it might get to a point where you've got polyethylene wear, and you just open it up, change the polyethylene, close the knee back up.
Is that like the outside of the
that's like
joint?
that's the plastic piece that goes in between. So in knee replacement, you have a tibial component, which is basically a metal tray that goes in the tibia. On top of that, you have a polyethylene component, which is going to be in between that, and the femoral component, which is basically a resurfacing of the joint surface that's metal as well. So you've got metal, plastic, metal. And
almost like a meniscus / cartilage.
Exactly. That's
both, I guess.
Exactly. It's the meniscus / cartilage substitute, so to speak. And so that can wear down.
So they don't necessarily have to remove the metal pieces. It's just the
not
polyethylene
necessarily.
pieces.
Exactly. You have to, if sometimes you can get loosening of those components. You can get from the wear, you can get plastic particles that can induce the loosening, for example. And then that's when you're thinking about doing a revision where you change the components and you're gonna have a bigger surgery.
Gotcha.
Yeah.
This is all good to know because, like, as a PT, obviously we want to do more conservative treatment, but I didn't really think about the other side of it where, like, maybe the person puts off surgery for so long that the arthritis is so bad that it makes the surgery a lot longer and a little bit more difficult to perform too. Because if they are going to eventually need the surgery no matter what, then there's like probably a sweet spot where they want to get it, right?
Exactly.
Where you don't want to wait too long.
And I think different surgeons also have like different levels of comfort. And to a lot of them, they may say, oh, it doesn't matter. We'll get it done. We'll get it down. Your outcome's going to be the same. But I think it's really hard in research to kind of figure out which person is on, are they outcomes? It's really hard to separate the cases after they've been done as to, how bad was their arthritis at the level of them and are they doing better? It's difficult. Not impossible, but it's difficult.
Yeah. Another thing we kind of talked about a little, and I don't know if you do this as much as a surgeon, but for our patients, we've noticed that people are not prepared for the amount of work or the amount of, I guess, pain that they're going to have after surgery, especially after a knee replacement. That's like for us in PT, that's known to be like the worst is if you're coming into PT with a knee replacement. So some doctors do a good job of warning patients that they're going to really have to put in a lot of work even after surgery, and that surgery is not going to like fix everything. They still have to put in a lot of work and do their stretches, do their exercises, be very religious about those things. So, yeah.
I think, again, this is all communication before. I've heard that knee replacements are extremely painful. I haven't had one myself, so I can't tell you. But there's a lot of patients.
I hope I never have to have one.
Same. I've heard that patients, they say it's actually a very painful surgery.
Yeah.
I mean, it makes sense. We're cutting your bones. We're making a big cut on your joint and then sewing it back together. You've got basically an inside scar and an outside scar, or wound that is closed with stitches. And
the knee is also so mobile, or it has to be mobile.
Exactly.
Compared to like the hip is usually a much smoother recovery for people compared to the knee.
It's also, the hip is deeper. I just don't think it's got as many nerve endings going into it, as the knee. Think about it. If you hit your kneecap against something, it hurts a lot.
Right.
And now you're using a saw and cutting part of the kneecap off. It's going to hurt. I think a lot of it is the communication prior with the patients. I know at least at UIC, there's patients who are going to get signed up for joint surgery. They have to take a class.
Like the joint program.
Yeah. And then they have to find out. And again, that's PT driven. And one of the surgeons says, once I put the last stitch, it's your job.
Yeah.
To get it moving. And it's true. And I think the patients who do the best are the ones who are highly motivated and they will move the joint and they will get to it. I remember this one guy who really wanted his knee fixed, and he's like, I go see him the next day. He was wearing the ice the whole day and he was already moving the knee like crazy. It was impressive to me.
Yeah.
In his first post-op visit, he just walking, just doing great. He's like, look what I can do, which gets on one knee, on one leg, and does a one-leg stand. I was like, kudos to you,
so it was
for doing
basically
that.
2 weeks after his surgery, probably?
Yeah.
Yeah.
So I think a lot of it is just how motivated our patients, how pain tolerant they are.
Yeah.
Everyone, they've got a different pain tolerance. And for some people, it's going to be more difficult than for others.
Yeah. Okay, let's get into the fun stuff. Okay. We love your content. You're very popular on social media, where you make funny and also some educational videos for people to enjoy. Didn't know that surgeons could actually have a sense of humor. No, I'm just kidding. How did you kind of come up with the idea, and then how did you grow your account to where it is today?
And well, first of all, thank you. I started posting on social media probably in 2018, I'm going to say, just on Instagram, posting pictures and sharing my experience with medical school. And then after that, the pandemic happened and TikTok became more popular. And at first, I didn't want to join TikTok because it's like for little girls to dance. That was my concept of TikTok. But my roommate kept sending me videos and I thought they were hilarious. So I finally made an account, and then a couple of months later, I got the courage to make a video and post it. And I started making some educational content, some funny videos, and you get to know the community of other people doing the same things, and you start talking to them, and that kind of encourages you to keep going and posting. And for me, the moment where I was like, okay, fine, I'm going to do this is I remember it was in the middle of the pandemic. I was going to get together with my co-research fellow at the time. And he was coming over, and I was like, let me just make a quick TikTok video. And I did a simple stitch with, I think the song was Savage Love from Jason Derulo. And I posted that, and then I didn't think about it. And I was talking to him. At the end of the day, I look at my phone. It was blowing up with notifications. I'm like, what's going on? And the video had reached 600,000 views in like 2 hours. And I'm like, what's happening? I'm like, whatever, it's probably going to stop. And then it kept going until it hit 17.5 million views.
Wow.
And my account went from, I think I had 3,000 followers to 150,000 over the course of a week.
Dang.
And I was like, fine, I guess I'll do this.
I'll do this TikTok thing,
exactly.
I
I
guess.
guess I'll repeat. I'll do a more complicated stitch next time. Right? But and then the funny stuff was mostly just for me because I thought it was funny, and I enjoyed making the videos, and then other people enjoyed them too. And whenever someone tells me that they got a laugh out of it, that to me is the most rewarding. So that's the motivation, making at least someone laugh, brightening up someone's day.
Yeah, no, it's like huge because I feel like medicine can be very like people think it has to be very serious, and it really doesn't have to be. Like we can have fun and like still be healthcare professionals, you know?
Exactly.
Like we want to do both because otherwise like why are we doing it, right?
Yeah.
And I love to have fun with my patients too. I'm like there's some patients I'm like I have to be serious for, you know, and that's all they want me to be, just a healthcare professional. Or I'm like we're going to see each other twice a week for at least 6 weeks. Like we've got to talk a little bit. We got to have some fun with it. But yeah, that is really cool.
Yeah.
Wow.
I think not because you're a healthcare professional doesn't mean you have to stop being a human.
Exactly.
You know, we go through the same emotions and things that other people do in other professions too. And, you know, we develop a sense of humor that's unique. And I think it's great to be able to share that with patients and other healthcare professionals.
Yeah, totally. Well, in Prime PT fashion, I would like to ask you about some of your goals. What are you looking to accomplish through your social media? What do you want your followers to get out of your account?
I think I want to make people happy. That's one of my goals. I want to make people smile. I want to make people laugh. I think another goal of my social media is to provide basic education, advice, tips, tricks, both to patients, just the lay person, and medical students, pre-med people, kind of give them a glimpse of what the life as a doctor is like, and just helpful educational material that people may want to know or may remember just because they watched the video. I think in the future, I might want to leverage it to open when I have a practice or when I join a practice, to encourage people to come to the practice and see me in person as well. Hopefully they want to they want a doctor that they can relate to, who is a little bit more laid back, and hopefully something like that happens. We'll see.
Nice. Yeah, it's always social media is great too, like because you talked about before how you connect with other people from all around the world, really, that are like-minded and in a similar profession to you that you never would have had access to if you didn't post these silly little TikTok videos, you know?
Exactly.
Like even we had a PT from Australia reach out and he was like, hey, I've been listening to your podcast and like would love to talk about like the differences between like his practice and our practice, like in the different countries. So social media is amazing. And then also, getting referrals or getting patients to come see you because they like your content or they see a different side of you than they would have just coming into your office, I guess. So
exactly.
Social media is awesome.
Exactly.
Well, is there anything else you want to say before we kind of wrap up?
Well, first of all, I want to say thank you for having me as a guest. I really appreciate it. Yeah. I think if anyone listening has any questions or about medical school, orthopedics, advice for any of that stuff, they can reach out. And usually best way to reach out is probably DMing on Instagram. I try to get to as many messages as possible. Sometimes it's hard. Sometimes it takes me a while. But, I'm trying to juggle residency and...
No, we'll give you some grace.
But yeah, thank you very much for having me.
Yeah.
This
Oh
was
my
fun.
gosh. Honestly, the honor is mine. Like, I want to thank you again for finding time in your really busy schedule as an orthopedic resident. I was like shocked that you were like, oh, yeah, sure, I can make it work. Like, I really appreciate it because I know you guys are super busy and worked super hard. If you guys want to see the rare, funny side of an orthopedic surgeon, we will link all of Diego's social media in the description of this episode. Don't forget to follow us at the Physio Diaries podcast for weekly episodes where we will have more guests in the future for you guys to enjoy. Thank you. All right.